So normalizing the conversation and just having the hard conversation and talking about it and not shying away from it. So talking about it at home, talking about it with friends, normalizing those consent conversations is a really good place to start.
Today I'm here with Megan Manasco. She's the SANE director at Arise. How are you doing today, Megan?
I'm good. How are you?
I'm doing good. Can you tell us a little bit about what Arise is?
Yes. So at Arise Sexual Assault Services, we're based here in Portales, New Mexico, but we do serve 6 different counties. So we cover Curry, Roosevelt, Quay, DeBaca, Union, and Harding counties. And we provide all kinds of different services. We have sexual assault nurse examiners, we have counselors, and we also have victim advocates as well. And we have outreach and prevention.
So today we're just going to talk a little bit about SANE exams, STI testing, and consent. It's April, so it's Sexual Assault Awareness and Prevention Month, and we want to make sure that you guys are well educated on that. So thank you for coming on today.
Yes, thank you for having us. We're excited.
Can you tell me what the SANE advocates do?
Yes, so our advocates at Arise are really awesome. They are able to provide a million different things. Like, they get to wear so many different hats. First, they can provide accompaniment to anybody who comes to a SANE exam or a forensic exam of any sort. They can be there as a support person. That's what they do. Their whole role is to support survivors throughout the process. So they can go to our medical exams, but they can also go to like law enforcement. If somebody decides to make a report, the advocate can go and be that support person there as well. On campus, they can go assist if there's a Title IX investigation. They can attend that. They can help with different resources in the community. So if somebody needs assistance with moving housing or safety, anything like that, they can play that role. They're amazing. They get to do so many different things and help people. If there's a question somebody has, they're going to be able to find the answer somewhere.
That's wonderful. Along with the advocates, can you talk about the SANE counseling that you guys offer as well?
Yes, so our counselors provide services not only to survivors, but also anybody who was directly impacted by the crime, by the violence. They can provide counseling to family, friends, any support people within that person's life. We have several counselors. A great thing about all of our services, not just counseling, everything is free. Nobody's going to be asked for insurance information. It's confidential, and people can receive our services without having to come in and pay anything. Typically, we're not even asking for like your ID or any of that information. So our counselors are there, and they're trauma informed. They're trained in these specific acts of violence, right? So they're able to help patients work through that. And if they need long-term support, they offer that. They can also assist in providing different counseling resources if that's something somebody needs as well.
So you guys have a hotline. You have your statewide hotline, and you have a website. So how can people access those, and what can they find on that?
So super important first is going to be our Rise helpline. It's 24/7. It's operated by our advocates. And so anybody can call at any time, and an advocate is going to pick up the phone and answer questions that they have and provide resources. So that phone number is going to be 575-226-7263. We also have the statewide helpline as well that everybody can call. With that, it's really great for people who aren't local to us, because I know there's people distance learning and things like that. So the New Mexico statewide helpline, you can call that It's kind of the same thing, but they're going to link you with your nearest resources. They'll help you find the program that can support your needs in that moment and link you to them. And that phone number is going to be 1-844-667-2457. And then you mentioned, yes, we do have our website. You can go onto that website, and it's going to provide information about the services that we offer. It also provides information about requesting outreach and prevention presentations or tabling events. It allows people to email us. There's an email linked that if people have questions that they're just not comfortable calling to answer, they can email and somebody will get back to them.
So what kind of questions could people ask within that email?
Any kind of questions.
Anything?
Anything that they may want to know. If they are concerned about, housing, they could email and ask about housing. If they're having questions about, hey, I'm having these symptoms after something happened, they're not comfortable asking those, they can email. We will get in touch with them. All of the different things, really anything could get asked, and we're going to get back to those people who really want to reach out for help.
Okay, awesome. So you talked a little bit about the statewide helpline versus the hotline used here. So there's a difference in local law and state law as far as SANE services go. So what are some of those differences that you can really point out and make sure people are aware of?
So all of us are going to practice under the same laws as far as, sexual assault exams and consent and all of those things across the state. Those are going to be the same. The differences in local services versus different programs across the state is going to be, we're all housed together. There aren't a ton of programs throughout the state that are all housed in the same building. So our advocates, our counselors, our forensic nurses, we're all housed together. So we're one pretty easy one-stop access point for everything. Throughout the state, there's going to be different programs set up different ways. So some programs are going to have advocacy in one program and their forensic nurses are located at a separate program. It doesn't mean that services are necessarily going to change. Everybody's still going to work together to provide all of the different services that a survivor may need. It just might look a little bit different accessing those services. So where at Arise, you're going to call one hotline and you're going to get set up. That may not necessarily be the case throughout the state. However, each of those different programs will get you linked with all of the services that you need.
Wonderful. Okay. That's very helpful. Let's talk a little bit about SANE exams. So what is a SANE exam and who's it for?
So a sexual assault nurse examination, that's what SANE is short for. And we provide those for survivors of sexual assault. And with those examinations, there are several different options. The great thing about them is that people can come to us whether they're making a law enforcement report or not. We can still do the same things that we would do if they are making a law enforcement report. So with the exam, everything is based off of patient consent. So if a patient decides halfway through the exam that they're like, nope, this is too much, I'm overwhelmed, I want to stop, we're going to stop. Part of that is we want to give patients autonomy back over their body. So if somebody comes in to see us, very first thing we're going to talk about is consent for the exam. Throughout the exam, it is kind of like going to the doctor's office in the first place. We get vital signs, we do a head-to-toe assessment, we are asking in-depth questions about what happened. The reason that we have to ask those questions is so that we know how to best help our patients, right? I need to know where I'm looking for potential evidence to take those DNA swabs. I also need to know where I'm looking for potential injury to possibly take photos of that injury. All of that is going to give the best exam for the patient, right? The more information that I have about the events that happened, the better exam I can do, the better evidence I can collect for that patient. So during the exam, we'll collect those DNA swabs. We'll collect forensic photography if that's something that they're interested in. If they are reporting, they can consent to have us turn all of that evidence over to law enforcement, where it then gets sent to the crime lab to be tested. If they are not reporting, we will store all of that evidence for 2 years. So they've got that 2-year time period to decide if they want to report or not. They can think about it. It's sitting in our office. Not every program stores evidence. Some have to turn it over to law enforcement, and they store non-reported evidence. But here we do store it. So they've got 2 years to make that decision about whether or not they want to report. They don't have to make it in that moment. But coming in and seeing us within the time frame, we can collect that evidence for them, and they have it available.
That's incredible. I didn't know you guys held it for 2 years.
Yes.
That's a really good resource in my personal experience, that's something that would have helped greatly. So that's really awesome.
Yes. And that's for anybody over the age of 18. If it's happening in like those adolescent years, because I know, some high school, college kids may be listening and they may be under the age of 18. So with that, those ones will get stored up until like their 20th birthday.
Oh,
so
wow.
They have a little bit more time to make those decisions as well.
That's very important, just to critically really think about that and make sure it's something that they want. So that's
Yes.
awesome. So what can somebody expect during a SANE exam?
So patients that come to us, what they can expect during the SANE exam is, one, our nurses are super patient, and what's really great about our job is you're our only patient at the time of the exam, right? So we are caring for you. We're on your timeline. You can come in and we're going to be patient throughout the process. Like if you need a longer amount of time to tell us what's going on, we're going to work through that together. But things that can be expected is we're going to ask questions about what happened. We need as many details as possible to be able to provide the best level of care. At Arise, you're going to have an advocate with you who can be in the room for things if you want, or also not be in the room for any part of it. They're there to support you. During the exam, we're going to keep as much modesty as we can throughout. So when somebody comes to see us, we're not just having them get undressed and immediately doing this, traumatic exam. We're going to work through it, and we're going to keep patients covered when we can. We'll collect those evidence swabs if they want us to. We're going to frequently be asking, making sure that they're okay with the steps in the process. We're going to ask, do you want us to collect pictures? Do you want to wait? And if there's injury, we can discuss pictures at that time, and checking back in, making sure that the patient's okay throughout the entire exam. We will also either provide medication right then or schedule the patient to come back for medications to prevent gonorrhea, chlamydia, and trichomonas. And we can provide prophylactic medication just because we're under the assumption that likely with a sexual assault, one of those infections is likely to happen, right? So we provide medication to treat that prophylactically. We're also going to provide resources for testing, because regardless of if I give you these medications to prevent these 3 sexually transmitted infections, there's still so many more, right, that we need to be treated for or tested for and then treated if positive. So we'll provide those resources. We can assist with scheduling that if that's something that somebody is interested in. We will talk about safety planning. If there was drugs or alcohol involved, we can collect urine or blood to be able to test for those. We can't test without a law enforcement report. It gets sent to the toxicology lab to be tested in those cases, but that's an option as well. If the patient wants our assistance with reporting at that point, we can also assist with a law enforcement report.
Okay. So how soon after should a survivor come to you guys for an exam? What's the time limit on that one?
As soon as possible.
Okay.
We want to see everybody as soon as possible because, you know, showering, bathing, even peeing, you know, all of these different things, the longer that goes on for, the less likely we are to be able to get DNA whenever we do those swabs. So as soon as possible after, typically we have about a 5-day window to be able to see adult patients.
Okay.
Is also important that, so within that 5-day window that we talked about at the beginning, patients can get like evidence collected during that time, but they can come see us outside of that 5-day window too for the STI prophylactic medications and then referrals. We have a 30-day window for that.
Okay, awesome.
Yes, we'll provide resources, we'll provide referrals if people want to sit down and make appointments, like, and phone calls right then. We'll help them get connected to like public health or their primary care provider if they're interested in that. But they're coming to see us so quick after an assault that likely if a sexually transmitted infection was like contracted at that point, they wouldn't test positive for it.
Oh, wow. That's interesting. From
that time. Like, it's got to have time to develop in your body. And because you're coming right away after, a lot of times it wouldn't be a positive result from that event.
Right.
So for that reason, we provide the resources to go get tested, and we provide the prophylactic medication, right, to keep those ones from developing in your body. And then the others, we're going to refer you for testing for those.
So how long would you say it takes for an STI to fully develop?
It's going to depend on everybody's body. I'm not going to answer that question with a time frame at all, but typically we'll tell people to go start getting tested at about 2 weeks.
Okay.
After. There are some other like other prophylactic medications, like HIV prophylaxis, that would need to happen sooner. Mm-hmm. So we would help with referrals to get that medication. But otherwise, everything else will help refer for testing.
What about cases that don't involve penetration? How can you examine those?
So it's going to depend on what exactly we're told, right? Because every case is going to be different. Right. Even if there's not necessarily vaginal, anal, direct penetration, if there are things where any genitals have touched anything, then we can still provide services. We can still collect swabs. We can still talk about what different options may exist for those patients. Mm-hmm. Another thing that is really important, we do offer, I know we're not talking about penetration right now, but we do offer Plan B.
Oh, awesome. That's great.
If they get tests within that window, within like those 72 hours, we're able to provide Plan B for the patient as well.
That's wonderful. I didn't know that. That's a really great resource to get that too.
Yes, for sexual assault patients, we're able to offer that.
So what can people expect coming in for a SANE exam between differences of like genitalia? So male versus female, penis versus vagina. What can we expect here?
So there are going to be some differences in the exam process, but not a ton. So for people with male genitalia, typically medications might look a little bit different. They might not get the one for trichomonas without having symptoms. It's just not as common to contract that. So they may not get that medication. And of course, there's not necessarily like a speculum exam or a pelvic exam. All of the swabs will take place on the outside of the body for those type of exams. But really, whenever you come in, you're getting the same type of treatment. We provide services to every gender, every race, every age at Arise. There's nobody that can't come in and get an exam from us. And the difference between like female genitalia is, of course, we're going to have the option for a speculum exam where we can look internally and see like the cervix and those inside structures and be able to take DNA swabs a little more accurately from like the cervical os right in that area. So that's really going to be the big difference. Otherwise, we're still going to ask the same questions about what went where, what touched what, and then collect based off of what we're told.
Okay. Awesome. Okay. So let's move on to consent. So you talked a lot about how you guys prioritize consent in your exams, which is obviously so important. Consent is important in everyday life. So how can college students specifically practice enthusiastic consent in everyday life?
So I think just having that in normal conversation, right? So asking before you do anything, before you hug somebody. I am personally like the world's most awkward hugger. So if you give me a heads up, like, hey, are you good with a hug? Like, give me some time to process that, because I may not always be. Sometimes I'm a don't touch me type of person. And if you're coming in for like a hug, I'm probably not actually down for that.
Right.
So asking just in those moments, you know, if that's something that's okay. I think that practicing it in dating in general can be really beneficial, you know, asking, hey, are you okay with this? Just whether it's the silliest thing, you know, holding hands, touching legs. I know that it all sounds really silly and it sounds like it might make it awkward, but it doesn't.
Yeah.
It doesn't. It's about having that respect for the person that you're with, because I may not always want that, you know?
Absolutely, yeah.
It may be based on the time, and I sometimes would really appreciate being asked, like, hey, do you want me to touch you, or would you rather just have a second?
Yeah.
And I think it's just having respect for anybody, friends, family, anybody that you're with, to ask those questions, and it makes them feel respected. Like,
absolutely. That's exactly what I was going to say, is it helps with respect and everything, and it also, as awkward as it might feel, I found it to be like the sweetest question people can ask, is like, I respect you enough to ask you your opinion on this. Like, if it's your body, you know, your space, your choice. Yes. So I think it's very, very important to ask. So what are some common myths that you think people need to unlearn about consent?
I think that people need to learn that consent is ongoing. Mm-hmm. It's not just a one-time, it was asked and answered, especially when we start getting into like sexual relationships, right? just because they said yes at the beginning does not mean that they are consenting to the entire act, right? There may be a time where they've changed their mind and now they're not comfortable, and it's not a one and done. We need to regularly ask, are you okay with this? Is like asking it and getting that explicit confirmation, right? And it doesn't have to be awkward. It doesn't have to be. Again, it's about respect and saying, hey, is that something you're okay with? It's okay to make it, sexy and fun and whatever. And the more you're checking in, probably the better it's going to be for both of you anyways, because we're respecting each other. We're both consenting. We're both saying, yes, this is something that we want to do. And there's no question about it.
So in relationships, consent is still so important, even if you've been together for years.
Yes.
So would you say that consent is something that prevents sexual assault?
Yes. Whenever we're asking those questions and people are giving that excited, like, yes, this is something that I want to do, then there's not an assault happening at that point, right? Like we're both consenting, this is something that we want to do. So asking for that is just leaving out that entire factor, and taking that no and stopping.
Yeah.
Right. Like it's okay for somebody to decide that that's not something that they want to do. We stop and we leave it at that.
Absolutely. I know my mind changes like constantly all the time. And so I don't think it's a matter of being indecisive. I think it's just standing up for yourself, honestly.
And also respecting that no.
Yeah.
When somebody's like, no, actually, I don't want to do this anymore, respecting that instead of taking away that choice for them.
Yeah, that's a really great way to put that. That's great. So if you wanted college students to know anything about consent, or maybe a key phrase of yours that you like to use or tell people, what would it be?
Yes means yes, and anything else you need to be checking in.
Yeah.
If somebody looks uncomfortable, let's check in. If they're looking like they're not enjoying it, let's check in, because they may be ready to stop and unsure how to say that.
Right, yeah.
Checking in and making it a regular conversation makes it less awkward.
Yeah. And even a no isn't always a blatant no. A no could be an I don't know, or a silence too.
Right.
Consent is not silence.
Yes.
So that one's very important.
Yes. Yes, enthusiastically, this is what I want to be doing. Anything other than that, you need to be checking in.
Yeah. So definitely on campus, I think it's a matter of normalizing consent and making sure that not only, obviously it's an act of respect, but it's an act that we as people need to respect too. I think when you respect something, it doesn't become so embarrassing.
Right.
Because I understand that some people do find it embarrassing. So just making sure that it is the culture, for sure.
Yes.
So does Arise do any community outreach, any tabling events? Where are you guys at?
Yes. So we do have an outreach and prevention advocate that goes into the communities. They'll table at college events here in all of our different communities. So they go to Tucumcari and table at events there. They also go into the schools and provide education starting very early. We start at kindergarten and teach all the way up. It's not about sexual violence. Everything is age appropriate. So they're going out and teaching about healthy relationships and healthy boundaries and trusted adults, things of that nature, based on grade level and education level where it's appropriate. They'll also do any kind of outreach event. So if there's a presentation, that anybody wants, you know, at a college level. Sometimes we have like athletic teams ask us to come present to them. They can go and present to them about consent and really anything that anyone wants to know.
I think learning is fun, especially like the staff at Arise, I think would be so fun to learn from. So how do you think that we could normalize talking about consent and sexual assault within, you know, our families or our friend groups on campus and just on campus in general?
I think just having the conversations, having the hard conversations, right? Like sexual assault, my job alone, people are like, oh, you. And it's because it feels awkward and it feels scary and it feels like a really taboo subject, right? So normalizing the conversation and just having the hard conversation and talking about it and not shying away from it. So talking about it at home, talking about it with friends, you know, normalizing those consent conversations is a really good place to start, but also thinking about it as an education opportunity too, right? Like the more you know, the better you're going to be able to act on these different things. So even just having a conversation about like our services and different things that are offered in a regular conversation so that it's not waiting until those resources are needed immediately and somebody not knowing that they exist. We do fun things too. I mean, we're out in the community. We try to, you know, come talk to people about not just sexual violence. Like, yes, that's what our jobs are, but we can talk about healthy relationships and boundaries and things like that. So just even having those conversations, you know, like with your friends about that maybe doesn't sound like the most healthy relationship, and being honest and having conversations, like making it normal.
Yeah. Pointing out the red flags where they're obviously standing, for sure.
Right. And just having the conversation.
Well, thank you so much for coming on today.
Yes.
I really appreciate you and everything that you guys do.
Thank you for having us.
I love the education part of it and everything. So I appreciate you. I hope you have a great day.
Thank you. You too.